Again, I'm not questioning the science. I'm glad you refrained from testing mandates, but I'm questioning your communication strategies. It's no wonder that the American people are confused.
I have heard from so many people who find the latest CDC isolation and quarantine guidance confusing.
Maybe if I could just rewind the clock to just before the holidays, where we were hearing from hospitals that their staff were going out and that they were in a real crunch in terms of beds. They had plenty of beds, but they didn't have staff to staff them. ICU beds were starting to close. So immediately we worked towards our updated healthcare worker guidance. But when we did so, we recognized that we were going to have challenges and that this Omicron surge that we were about to face was threatening many other places of our healthcare sector.
I appreciate the background, but I just want to know, straightforward, if someone is exposed to or has COVID-19 and they're vaccinated, what do they do?
If they are exposed to COVID-19 and they are completely boosted, they do not need to stay home, but they should get a test at day 5. If they have COVID, our guidance does not distinguish between your vaccination status. And our science has demonstrated that you're maximally infectious 2 days before and 2 to 3 days after. So by 5 days after your symptoms, if you're feeling better, if your fever is better, if your cough and sore throat are better, then on day 6, you can go out, but you have to wear a mask.
When you say when people have been exposed, please let us know what it means to be exposed. We're in a room right now. I'm sure someone here has Omicron. Are we all exposed and therefore need to get tested?
The CDC guidelines make that very clear, and it is if you are exposed to an individual with known, if you are in a period of 15 minutes at a time or a total of 15 minutes over a 24-hour period in a situation where you come into close contact.
The idea that a government official like yourself would claim unilaterally to represent science, that any criticism of you would be considered a criticism of science itself, is quite dangerous. A planner who believes he is the science leads to an arrogance that justifies, in his mind, using government resources to smear and to destroy the reputations of other scientists who disagree with him. In an email exchange with Dr. Collins, you conspire, and I quote here directly from the email, to create a quick and devastating published takedown of 3 prominent epidemiologists from Harvard, Oxford, and Stanford.
The email you're referring to was an email of Dr. Collins to me. If you look at the email
that you responded to and hurried up and said, I can do it. We got something in Wired magazine.
No. I think in usual fashion, Senator, you are distorting everything about me.
Did you ever object to Dr. Collins' characterization of them as friends?
Senator, we are here at a committee to look at a virus now that has killed almost 900,000 people. And the purpose of the committee was to try and get things out, how we can help to get the American public. And you keep coming back to personal attacks on me that have absolutely no relevance.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.